Hi, my name is Dr. Heidi Prather. I'm a board-certified dermatologist and I work at Westlake Dermatology in Austin, Texas. Today what I'd like to do is demo our Picocare laser. Here it is, and this is an amazing piece of machinery. It's made in Korea by a company called Westlake. And what's wonderful about it is it's a traditional picosecond laser, but we can really toggle between different settings. So here we have our MLA handpiece. This is a multi-lens array. So what that means is it actually delivers a fractionated laser energy on the skin, and it creates what we call LIOBs, which are just kind of small areas of laser injury isolated to the epidermis and superficial dermis, which are going to help things like pigment, skin texture, and aging. And we are going to use this today with our fabulous patient. He's already received 2 treatments. And what we've been focusing on is kind of a layered approach where we can treat not only the lentigines, so all of the small brown spots, but also if you look closely, he has some patchy hyperpigmentation on the cheeks called melasma. And melasma is a pigmentation disorder that occurs due to sunlight and hormones. And we see it most commonly in women, especially with darker skin types, but can also be seen in men. And so this is commonly missed and underdiagnosed. So it's important to be aware of it, to recognize it, treat it properly, and educate patients on sun protection and using SPF regularly. We'll go ahead and pause here and we'll switch over to the treatments in just a second so we can put on laser safety eye gear. All right, so we are back to start with our melasma portion of this treatment. Again, we're using our Picocare device made by Westlake. And let's go ahead and look at the screen. I just want to demonstrate just how easy it is to switch these settings. You can really increase energy without any recalibration, change the frequency or speed of the energy delivery, and even change the handpiece. So we have a 1064 wavelength selected now. This device can change to a 532 and even a low energy 532, bringing the total joules down to 0.1 to make it safer for darker skin types if you ever want to use the 532 for pigmented lesions. So we're going to go back to our 1064. We're going to go to a low laser energy because for melasma we want low heat, low energy on the skin. And our patient knows that we're planning on doing multiple treatments. So often you start to see results, sometimes as early as 3 treatments, but really can take 6 to 10 treatments spaced every 3 to 4 weeks. We have some cold air cooling the skin as we treat, but really this treatment doesn't hurt. We do the cold air to keep heat off the skin because we know heat can flare melasma. So we're going to go ahead and start. Everyone in the room has on laser protection. And 1, 2, 3. And you can just see how quiet and elegant this treatment is. We're moving the handpiece back and forth. This can be focused just on the patches of melasma or to the full face. I choose to treat the full face for this patient because we do have more pigment scattered everywhere. And ultimately we're going to do 2 passes. And really the number of pulses is going to be determined by the speed of the frequency of the laser, but also the handpiece and how you move it over the skin. How are you feeling right now?
Feeling good.
Is anything hurting?
No.
Perfect. So easy breezy. We'll blend it into the forehead. And we'll do the same thing to the other side of the face. I know you've received 2 treatments so far. Anything that you want to comment on and what you've noticed in terms of improvement after the first 2 treatments, comfort level or downtime?
Yeah, there's very little, there's no downtime. My skin felt great even right after the treatments, and I do think I noticed specifically my blotches of melasma lightening up a little bit or decreasing in size, so very happy with just the first 2.
Excellent. And one of the things that's going to be most important to the success of this treatment is good skincare. So we do have our patient on brighteners twice a day. We're using Discoloration Defense by SkinCeuticals just to help kind of brighten the skin. And we also have a prescription hydroquinone that we're using once a day just to create a little bit more protection, especially because we're in Texas. It can be really sunny And of course, we're using sunscreen every day. I recommend at least an SPF of 30 and a mineral-based formula. So that's with zinc oxide and titanium dioxide. All right, so we're gonna switch gears here to a pair of blue glasses. We'll give our camera woman a new pair of eye protection for this particular wavelength. Perfect. And we'll go ahead and reset the laser. All right. Okay, so the beauty of this device is we can go in and target some of the freckling. And what we want to do is keep the energy moderate for just a light whitening. So we're just looking at our endpoint here. And 1, 2, 3. Again, this tends to be more bright. Beautiful. And we're just going to go through and do some spot treatments here, just to help with the overall tone and evenness. Because he does have a lot of freckling, he is a good candidate too for the fractionate at 532. You just want to be very careful using that in darker skin types because you can get some post-inflammatory hyperpigmentation if you're not careful with your settings and your preventative skincare. I'll just move around and even everything out. Now for our patient, he does not want to remove all of his freckles, so we're not being overly aggressive, and it's also another reason that we're not doing more of a full face treatment to brighten it, but he's agreed to let me treat some of them because we're here, we have the technology, and it's fun to use, don't you think? Beautiful. And this is just helping break up that pigment. While this treatment can improve lentigines with even one treatment, I usually prefer to treat it over 2 to 3 sessions to minimize any risk of post-inflammatory pigmentary change. Beautiful. All right. We will pause there, and I appreciate everyone watching this video. I hope you found it educational. And if you have any questions, please don't hesitate to reach out at Westlake Dermatology. Thank you.